My mother was just a child the first time she went into the foster care system. She was ripped away from everything she knew. This led to a drug addiction later in life, and I was just a child the first time I saved her from an overdose. Sadly, the connection between foster care and addiction has become even stronger. According to Child Trends on February 26, 2019, the number of children entering the foster care system due to parental drug abuse has risen to 131 per 100,000 children, leaving children as the youngest casualties in a nationwide epidemic. My mother is now 10 years clean, but her story is just one of many where if resources had been readily available, it could have saved us both the heartache. However, my story is unfortunately very common. Therefore, it is imperative for us to address how the opioid epidemic is ravaging the already overburdened foster care system. Today, we will address the causes, effects, and solutions to the opioid epidemic on the foster care system. The YouTube channel WCVB Channel 5 Boston posted a video on May 16, 2019, exposing a foster home where 6 children were beaten and tortured while the state turned a blind eye. Although there are many factors that have caused the opioid epidemic and the influx of foster children, today we will examine the 2 main causes: the overprescription of opioids and overwhelming the already overwhelmed foster care system. The overuse of opioids in America is an ever-increasing problem. The overprescribing of these highly addictive drugs is causing death rates to rise along with addiction rates. According to the National Institute on Drug Abuse on May 27, 2020, 128 people die every day from opioid overdoses. Yet doctors every day all across America continue to prescribe these highly addictive drugs without thinking of the consequences. Next, the foster care system is an already overwhelmed and underfunded system. Hundreds of thousands of children every day enter the foster care system with less and less foster families to care for them. The Fatherly article on June 25, 2020 states that there are nearly 500,000 children in the foster care system on any given day. Furthermore, from the aforementioned article, 32% of all foster placements are attributed to the opioid crisis. Still, the government refuses to provide any relief, and children are being bounced from home to home to home, with no resources to help. On July 10, 2020, the CDC reported the story of Tessa, a mother of 2 who became addicted to opioids by age 18 due to a sports injury in which she was prescribed them. By age 28, Tessa was also using heroin, and both of her children experienced withdrawal symptoms and were placed into foster care. Tessa went through rehab and treatment 8 times before she finally turned her life around, but still has not regained custody of her kids. Tessa's addiction was the result of the reckless prescription of opioids, and this epidemic is having disastrous effects on the foster care system, specifically addiction-based neglect and rehoming. Due to the overprescription of opioids, neglect rates in children and addiction rates in adults are on the rise. As more and more parents become addicted to opioids, their children suffer because parents are spending money on drugs instead of childcare. The children are then forced to starve and watch their parents struggle until they get their next fix. NPR explains on July 15, 2019, that the amount of children entering the foster care system has more than doubled since 2000. They looked at 5 million cases from 2000 to 2017 where children were removed from the home. So, with addiction rates rising and more children being put at risk, why are these drugs still so widely available? The goal of these systems should be to reunite families, not tear them apart. Rehoming has become a widely used solution that actually does more harm than good. social workers take children from dangerous situations and illegally place them in what looks to be a loving home with a family member or friend. This sounds great, but in reality, that family member receives no financial assistance or resources from the court systems. On June 1st, 2020, the American Bar Association explains that social workers often use threats and coercion to force families to give up their child and other families to take that child without plans of reunification or resources from the child welfare system. At first, this sounds like a great idea to an overwhelming problem. But in reality, rehoming just causes more damage to children and their families. The National Institute for Children's Health Quality in 2020 reported the story of Samantha, a former foster child who became dependent on opioids by age 18, but after becoming a mother at 34, sought detox to give her child a better life, waiting 2 years for a space to finally open up. Samantha has since been clean, but still has not regained her parental rights. This is just one example, where if Samantha had been educated on the drugs she was taking, and the systems had been combined to work together with one common goal, Samantha could have gotten clean sooner, creating a better family for her baby girl. Greater education on opioids and harsher punishments for doctors who abuse their practice. An educated population is the key to ending any crisis. Educated people can petition for harsher punishments and stronger regulations on opioids. On May 27, 2020, the NIH states that the HEAL, Helping to End Addiction Long-Term Initiative, was launched to speed up the scientific solutions to end the national public health crisis. People must be educated in order to protest the misuse of opioids and petition for stronger regulations. Greater cooperation and transparency among rehab and family court systems will drastically improve family relations and reduce the amount of children in foster care. Right now, the systems work separately with different goals, but if they work together with one common goal, there would be less confusion and hassle for everyone involved. The Family Treatment Court's Best Practices Guide, published by the Center for Children and Family Futures and National Association of Drug Court Professionals in 2019, states that families that participated in family treatment courts were 2 times more likely to reunite, and the children spent less time in and out of foster homes. Overall, if local, state, and federal systems work together instead of independently, the positive outcomes for families are astronomical. Today we have discussed how the opioid epidemic has exhausted the already devastated foster care system by examining the causes, effects, and solutions. This isn't policy. This is people's health, people's children. We have lost enough lives this year. Let us ensure no more are lost to a system that is meant to protect them. It is time for change.